Hi, Sarais. We're going to review briefly what we just saw in class. So today we establish what were going to be the questions for your interview and the possible answers as well. So a little reminding. Remember, when you're talking about your day or something in the past, you talk directly with the verbs in past. Okay? So for example, I went to the doctor, he prescribed me. You can say he prescribed me or you can say he gave me some medicine, but both are correct. Also, he told me. As you see, all these forms of the verbs are in past. Now, if I ask you, for example, what symptoms do you have? Now you can say a lot of pain, my tonsils are sore, mis amígdalas, or also you can say my mom gave me some soup, etc. Okay, so remember, always use the past tense of the verb when you're talking about the past, and the did is only for the negation, okay, as an auxiliary. Now, for this type of question, when someone asks you, tell me about yourself, you can start, of course, with your name. I am Sarais, I am from Venezuela, etc. And also about what is your career, what did you study? So I'm a physiotherapist. I have a bachelor's degree in physiotherapy, for example. Tengo una licenciatura en fisioterapia. I studied at, and the name of your university and the place. I studied at Arturo Michelena University in Venezuela. Y luego, and then you can also talk briefly about what is your work experience or what are you doing now, but briefly, okay? Don't go into details in this part. Now, another question that can be possibly you ask, what interests you most about this role or working with us or working with our company, working with them, okay? ¿Qué te interesa más de trabajar con ellos? So you can say, once you have done some research about the place, you can say, I like the place, I like the work environment, I like the values, I like the type of therapies you give to patients, etc. What do you like about the place? Then you can say, for example, this job offers me stability professionally and personal growth, as you told me in the example. And finally, you can say, because I love caring for people, I like to help people, etc. Now we're talking about your skills and experience. There you have a lot of options. You can say, for example, tell me about your technical skills. So here you can tell everything you know about your career. I know how to treat diabetic patients. I know how to transfer patients. I know how to take care for a patient. I know how to evaluate a patient in a holistic way. I like to do recreational activities with patients. And also, remember, every time you say, I like to do something, try to give examples. For example, in the activities, recreational activities, give examples. What kind of activities do you do? And when they ask you about your work experience, then here you have to be very detailed. So here you can say, I have worked as, remember, he trabajado como something, at, en donde. And it's important here to mention what did you do in that company or in that hospital, in that nursing home, and for how long, for how many years. That's very important. Here about the task and how do you solve problems, or for example, how do you organize yourself. Here you gave me very good examples, so I'm gonna read them so you can hear my pronunciation, okay? So I have an agenda where I write all my activities and plan ahead my week. I like to get up early and think about what I'm going to do every day. And finally, I attend my patients only by appointment because physiotherapy is a program activity. So careful listening in my examples. Now, how do you solve a problem? First, I like to talk with the person about the problem. I support myself with my work team. I ask for help to a coworker. Now, I report the issue. Issue is a synonym for problem. I report the issue if necessary to management, etc. Okay, here you have all the examples you gave. Now, finally, when they ask you what is your greatest strength, you can say I am and all the adjectives here you have told me. For example, honest, good listener, responsible, hardworking, proactive, respectful, etc. And what is a weakness? What is a debilidad of you? And how do you overcome it? Well, you said I am very sensitive. I get affected by some experience from patients. For example, and then you give examples, what kind of experiences from patients? When they pass, when they develop sickness, when they are abandoned, when they cannot eat, when they cannot talk, etc. And how do you overcome? I share these feelings with a colleague or a psychologist and try to not burden myself with all. No me los trato de cargar todos. So that was it. Now, for tomorrow, don't forget to elaborate some questions that you have about the workplace. And see you next class. Be ready and get prepared for the interview. Bye bye.